Hello, everyone. My name is Dr. Morgan Lintz, and I'm with Ashley Chiropractic here in Raleigh. This is my third video chat interview with another health professional in the Raleigh community. This is Ashley Acornley, owner of Fueled and Fit. She is a dietitian and certified personal trainer. The goal of what we're trying to do here is, since we're all stuck inside, we're trying to make sure that you have access to resources within the Raleigh community for mental health, for nutrition, for pain management, in order to make sure that you're still able to be well, be healthy, and stay on track for your goals while you're stuck at home with this stay-at-home order. So at Ashley Chiropractic, we are seeing patients. It is limited. We're working more with acute, emergent type care. We're also working with some active treatment plans. Basically, the goal of us remaining open and us being deemed as essential is to help keep you guys out of the ER and to help kind of free them up to have those resources for people where it truly is a medical emergency, especially with what's going on. We deal with a variety of conditions from TMJ, low back pain, neck pain, carpal tunnel syndrome, sciatica, disc herniations. You could go on and on. We have dry needling, acupuncture, manual manipulations or adjustments. We do myofascial work. We do therapeutic exercise. And now we're also able to offer virtual home consults to kind of do a virtual exam, try and figure out what your pain generator is and help give you some stuff that you can do at home so that you don't necessarily have to come in the office. So here, like I said, we have Ashley Acornley, owner of Fueled and Fit. Ashley, why don't you tell us a little bit about your business and what you do?
Sure. So I am a registered dietitian and a certified personal trainer, and I own a private practice in Cary, North Carolina called Fueled and Fit. I've been a dietitian for close to 10 years, and I received my bachelor's from Penn State. I received my master's from Meredith College, and I've had my own business for close to a year and a half now. So I do a lot of nutrition consultations, in-home personal training sessions, presentations throughout the community with different businesses, and some corporate wellness as well. So I touch base on a wide variety of different nutrition and wellness needs throughout the community.
Very, very cool. And so when it comes to dietetics, I know there are some different approaches to it. What's your philosophy to it? What kind of, would you think sets you apart, or what makes you unique?
Yeah, that's a really great question. And I feel like over the course of time, dietitians have become kind of the food police. That's kind of like a very popular term I hear. It's kind of something that we get kind of pegged for. However, I do not run my practice like I am the food police. I consider myself to have a very flexible food approach, meaning all foods can fit. Yes, some foods are healthier than others, and I, of course, encourage the healthier food consumption. But I take a wide variety of things into consideration. A person's likes and dislikes, food allergies, preferences, whether they work out or not, what their family likes to eat. There's so many things to take into consideration before I give any advice as to what a person should or should not be consuming. I also take into consideration medical history and medical diagnoses, medications a person is taking as well. So there's kind of like this whole comprehensive background and history I need to gather from a person first before we even get started with dietary recommendations. But I do try and keep everything as flexible as possible, and try not to be restrictive in any way for patients.
I think that's great. And I think a lot of people can respect that, because that's a lot of people's concern when they do look to start making changes, is then they can't have all these things. And I think that mental aspect of it really ruins and sabotages a lot of people's goals. And I like what you said there, because one of the big things we're trying to do in pain management, especially in the evidence-based world, is follow more of a biopsychosocial model, not just the biomedical model, meaning this hurts, fix it, not just chasing symptoms, but actually looking at why. Why do you hurt? And in order to do that, you have to look at the nutrition aspect. You have to look at the mental health aspect. You need to look at the anatomy and the ergonomics and what other things they're doing in their life that could be contributing to it. And so I think that's great, not just, giving a cookie cutter layout to every person, but digging deep deeper into their medical history and their personal history, I think that's where you're going to find the most success. So I think that's really great that you take that approach.
Absolutely.
With the stay-at-home order and with all that's going on in the world right now, I think that presents you with a pretty unique opportunity. I know there's definitely stresses just like any small business, but you have so many people stuck inside, with their kids, working from home, trying not to leave, and also the fact that it's a virus that we're working to kind of obviously avoid and stop the spread of. One thing that people keep talking about is the immune system, and the immune system and nutrition versus, not having a vaccine right now, so we feel helpless. What do you have any recommendations from a nutrition standpoint on what people can do to at least just supplement or give themselves a fighting chance?
Absolutely. So there has been no proven research that if you take a supplement, you're guaranteed to prevent yourself from getting coronavirus or anything like that. However, food and supplements definitely can help. There's no particular ways to boost your immunity, but there are certainly great ways to support your immunity. As far as supplements are concerned, the three that I'm working with primarily with patients are vitamin D, zinc and vitamin C, and probiotics. Those are the 3 to 4 main ones that I'm touching base with patients. And vitamin D has been shown to lower your risk of developing a respiratory infection. You can also go outside, enjoy some sunlight, and gather some vitamin D that way. Zinc and vitamin C have been shown to reduce symptoms and signs of colds and infections over time. Again, because coronavirus and COVID-19, they're so new to us, we don't exactly know whether it can work long-term with that, but it does help with colds and sinus infections and things like that. And probiotics are super important because 90% of our immunity is found in our gut. So probiotics help bring all that good gut bacteria back into our system, and it helps improve our immunity. If we have bad gut health or we're eating poor food choices over the course of time, it can really affect our immune system.
Absolutely. I love that answer, and I'm working a lot of those things myself, so it's good to hear that validated again by another professional. So along with that, there's a lot of jokes going around about like the Corona 15 or the quarantine 15. And while it's funny and it makes good humor on the media, I think a lot of people are truly concerned about that, especially parents home with kids and work from home, go to the gym. Do you have any tips to help, kind of mitigate some of that stress and help people stay on track from avoiding that quarantine 15?
Yeah, definitely. So let me first mention that this is new territory for all of us. We are not used to being cooped up in our homes for this long of a time. We are usually not under this amount of stress from a virus that might infect our family. I mean, we can go on and on about how we literally have to develop a new normal. So a lot of my time spent with clients right now is developing this new normal, creating a plan of attack. And it could be completely different than what they're used to doing on a regular basis. So I go into this, question by saying that everyone is going to be different and everyone's going to be dealing with this pandemic in different ways. My biggest recommendation is to stick with what I call the 80-20 rule. So what that means is you're creating a balance. You're not being overly restrictive in your food choices, but about 80% of the time you're making healthy food choices. You're cooking more at home. You're getting healthy groceries when you're ordering online or venturing out to the grocery store once in a while. And then 20% of the time, that's your time to splurge, to enjoy something with your family, to celebrate someone's birthday. I am not about creating restriction in someone's lifestyle. So if you can maintain that 80-20 in your lifestyle during this quarantine, you're doing an amazing job. Finding that balance is really key. And also, I'd like to mention too that stress management and sleep contribute to your cravings, to your hormone balances, to your food choices, whether you have energy to exercise or not. So that all plays a role. It's all kind of tied together at this point. So really focusing on the holistic perspective, not the do's and don'ts of dieting right now.
Yep, I love that. I love that. And part of that, truly, I was talking with Amanda Seavey of Clarity Psychology, and we're talking about how self-care right now looks a lot different potentially than it did even a few weeks ago. You know, part of self-care right now is just treading water. You know, if you've got 3 kids at home, it might be, you know, taking a shower today as part of your self-care. So it really is. It's not putting, you know, I'm really good at putting too much pressure on myself, as I know a lot of us are out there. And really, you know, I think the 80-20 rule allows yourself that 20%, you know, it allows you to, you know, you can call them mistakes or allow them to just like be yourself, to bake with your kids, to do these things and not stress out about it. And at least if you can maintain through this time, then if your goal is to lose weight, well, then we'll just pick up from there. And so I think that's really good advice that I hope people latch onto. And so you talked about stress management, and one thing I know, especially I've dealt with it in the past, is that emotional eating. You know, I'm bored, so I keep going and looking in the cabinet. What do I have? You know, do you have any tips on for those people who are bored eaters or emotional eaters? Do you have any little tips for that?
Yeah, I have a couple that I think could help people during this time. Because we're in new territory and at home where the pantry is readily available, it's extremely tempting to have these boredom or stress cravings. Number one recommendation is to keep trigger foods out of your house. So first you have to identify what your trigger foods are. If you were to ask me what my trigger foods are, they are Oreo cookies and any kind of ice cream.
Yes.
You can keep all the salty foods in the pantry and I won't even touch them. But the second you bring in Oreos or ice cream in my house, I'm consuming.
Yeah.
So number one rule of thumb is identify what those trigger foods are for you personally and try and keep them out of your pantry during this time. Second thing is keep your hands distracted. So whether that's FaceTiming a friend or working at your computer or crocheting or learning to knit or whatever the case might be, studies have shown that if you keep your hands occupied, you're able to reduce some of those cravings and that hand to mouth sort of connection.
That's awesome. Never thought about that.
The other tip I would have is to use what I call the 15-minute rule. So if you're really craving something, like let's say I'm craving Oreo cookies and you have them in the house, and you're really, really wanting them, give yourself about 15 minutes to think about it. Think it over. Do you really want this cookie? What are the pros and cons, et cetera, et cetera. And if those 15, 20 minutes pass and you still want the cookie, then eat the cookie. What you're doing is reducing that impulse to overconsume. So you're being a little bit more mindful, which is really what we're looking for. Last tip is if you guys are interested in more recipes related to some sweet treats or some salty options that kind of hit that craving, but they're healthier, I do offer a craving converter guidebook that has over 30 different recipes on my website. And it's been really helpful for a lot of people during this time because the family's home, the kids want to get involved in cooking, et cetera, et cetera. So, you know, you could use some of these recipes as healthier alternatives to hit that craving, but also spend time with your family and choose something healthier as well.
Right. That's a great idea. That's great. And I'll make sure we get that information out to people, because I think there are a lot of people that could use that book, because a lot of sweet tooths out there.
Sure.
So, and I guess that really was part of my last point is one thing that Logan and I are trying to do is we like to cook already, but we're trying to make more of an event, you know, like sometimes during the week, we're always going for those quick, healthy meals, you know, just quick baked chicken and some rice and a veggie and just like move on. And now we're trying to kind of make that part of our like centerfold of our evening and like really, use fresh veggies and cut them up, or make one recipe a week that's more elaborate and requires more ingredients. We're kind of trying to make that, everyone's so bored. Well, have fun in the kitchen then, experiment a little bit. And so I think that's a great idea. Great way to start teaching your kids some of those cooking, skills, while school's a little bit on the back burner. I think that's great. Do you have any other resources? We're going to talk about you here in a second. Do you have any other resources that you can recommend to parents at home with kids, maybe wanting to get into the nutrition, or just for people looking to stay sane?
Yeah, certainly. So I totally agree with you. I think that now is really the time to zone in on family time, cooking more, teaching your kids that life skill, eating more from the dinner table together. Now is really the opportunity. It's not time to throw in the towel and say, oh, well, we're quarantined. What do we do? It's really time to focus in on these habits and hopefully make them more long lasting in your family, in your home. As far as resources go, I love cookbooks. I love blogs. I think there's many out there, so many out there that you can choose from. I love Skinny Taste. So that's one of my favorite blogs to use. I love 100 Days of Real Food. That's a really great family-friendly cookbook and blog to use. And I also like Two Peas in Their Pod. That's also a blog that's really, really great, especially if it's just two people in the home. She does a lot of like cooking for two recipes. Skinny Taste and 100 Days of Real Food, great for everyone, but I would say those are more like larger family, friendly type of meals. But they're usually my go-tos right now.
Awesome. I hadn't heard of two of those, so I'll have to check those out myself. So Ashley and I got connected a few months ago now, and we still have a lot to learn from each other and plan to do more things hopefully in the future together. But I had Ashley at my office for one of my Wine and Wellness Wednesdays, which some of you have attended, and she did a phenomenal job. And one of my goals, and I'm sure yours is too, is to find people in the community that you can trust and refer your clients or your patients to confidently. And what I think is so great about you is how confident you are. You have a great educational background. You've done a lot of stuff. You have the experience, but there's something about having confidence in what you're preaching that I think is so important. And it gives me ease in referring to you and can give your clients ease as well. And so I really respect you, and I'm thankful to have found you. Because while I know stuff about nutrition, I want to stay on that pain side. I want to really stay on that anatomical side and have other people that's what they do full time, take care of that nutrition component. So thank you for being here. What are you offering right now? How are you adapting to this new normal in your business?
Yeah, so I mean, I do have an office in Cary, but for the time being, those office doors are closed due to the COVID-19 restrictions. So it's been an interesting change of pace, but I am now converting all of my clientele to telephonics or virtual sessions. It's actually been an easier transition than I thought. Insurance companies are being really, really flexible with their coverage during this time, which is making life so easy for practitioners.
Yeah.
So very thankful for that. And I'm also thankful that there's plenty of HIPAA compliant software that practitioners can use during this time. And it's as simple as just sitting in your living room, clicking the link, and all of a sudden I pop up and we talk for 30 to 45 minutes.
Fabulous.
So it's been working out really well. And I have no complaints at this time. It's actually been really a fun journey.
Good. And I think what people, and I didn't know this, that insurance will cover, what you do. And so United Healthcare and Blue Cross Blue Shield, correct?
Yes. I'm in network with United Healthcare and Blue Cross Blue Shield of North Carolina. Okay. They cover in-person sessions, and now they are accepting telehealth coverage as well for the extended future, as long as it takes for the COVID-19 restrictions to loosen up. Right. So that's really beneficial. And I highly recommend people take advantage of it right now.
Amen to that. I know, I feel the exact same way. And so if you've been wanting to get started, you need some motivation, well, now you can do it from the comfort of your own home. Reach out to her. We'll make sure you have that information to get in contact with her, especially if insurance covers it. To me, there's really not a whole lot of an excuse, you know.
Yeah.
And it's been great for us. Cigna, United Healthcare, Blue Shield, they have all been opening up their coverage as well. And so we get virtual consults covered too. And that's just a phenomenal way to stay in touch with your patients and clients and things of that nature.
Yeah.
And so I touched on the biopsychosocial model, and pain is a huge issue in this country and beyond. And so whenever we're dealing with pain, you know, there are layers to that, you know, and we're talking again with Amanda on my last interview about how, you know, if you have chronic neck pain and you're constantly stressed, or you have extreme anxiety or PTSD or something else underlying, if we don't also deal with that, you're going to have some level of neck pain most likely. And so same comes with nutrition. You know, we look at, you know, inflammation in the body and all the inflammatory foods that have become normal in the American diet. That's one of the big reasons, you know, I wanted to form this relationship and have this conversation, is because people don't, you know, even though it seems obvious, you know, people really forget about the connection that food does have with the wellness of our body. And so you look at obesity, for instance, in two facets with pain. One, you know, when you have that extra weight you're carrying around, you're putting more weight on your joints, putting more stress on your joints and your ligaments and your muscles, and that can be a pain generator. And then also, if you're obese, you know, there's probably a chance you're not eating as well as you should be doing, and now you're having this higher level of global inflammatory levels within your body. And so I think it's really important for people to know that. And I touch on that with patients in my office too, that, you know, you can't just go to a chiropractor and physical therapist, or go get a pill from your PCP and then your pain's done. You know, if you don't deal with these things, you know, whether it's right now or 5-10 years on the road, there could be some problems. And so it's not to scare people, but to inform people, like there's people like you to make sure that you set a good foundation now. And so that's really my big connection for this, and why a chiropractor is sitting here interviewing a dietitian. But do you have any kind of closing remarks on that, or just nutrition and now in general?
Yeah, definitely. I totally agree with you that it's a holistic approach. You need to tackle the inflammation from multiple layers, multiple professionals. As far as nutrition goes, experts are saying that if you lose anywhere between 5 to 10% of your current body weight, not only are you lowering inflammation and losing weight, but all of your lab values and biomarkers start to get back in normal range. So as far as weight loss is concerned, I know a lot of people want to lose a lot of weight, but you just have to start with 5 or 10%.
Yeah.
Just get started, and you'll start to see improvements there. From a specific nutrition standpoint, an anti-inflammatory diet or a Mediterranean style diet is usually what I recommend to help attack some of that inflammation. Another thing to take into consideration too is a food intolerance test, because some people may be intolerant to foods that are naturally super healthy for you, but yet you have some sort of inflammatory trigger for it. So getting one of those tests done, if an anti-inflammatory or Mediterranean diet isn't doing the trick for you, that could be the key to delving a little deeper and seeing what we can modify in your diet to help you feel better over time.
Absolutely. And you do those inflammatory like allergy tests, correct?
Yes. So I have a test in my office called the Pinner test, and basically all that it requires is a finger stick of blood. So I just prick your finger like I would if I was checking your blood sugar. I put it onto a little pad and we send it out to the lab, and they give us a PDF report of foods that you're not intolerant to and intolerant to. And then from there, we kind of play around with eliminating some of those foods and see if your symptoms improve.
Yeah, very cool. And I have a lot of colleagues back home that deal with the allergy testing, and I've had it done myself, and it's been a game changer for me. I think people don't always realize that they can do that. For me, toast, fruit sugars were on mine. I had no idea, and then turned out my great grandma also had issues with that, and so eliminating some of that made a huge improvement in my life. Which meant
Yeah.
limiting some fruit intake, which seems odd, but that made a huge difference. And so I think people don't know enough about that. And so I think that's really important to get that out there. But overall, well, Ashley, thank you so much for doing this. I hope we can do more of this in the future, and we may be having some events coming up in the Raleigh area, maybe this year, depending on what happens here. Give them just a quick one last just shout out your Instagram, your website, name your company, where they can find you.
Sure. So again, my name is Ashley Acornley. My company's name is Fueled and Fit LLC. You can find me on Instagram at Fueled and Fit LLC. You can also find me on Facebook under Fueled and Fit LLC. And my website is www.fueledandfit.us.
Perfect. Can't forget that. Well, and I'm Dr. Morgan Lintz with Ashley Chiropractic. I hope you guys found this informative. You can find me on Instagram at Raleigh Chiro, or the website raleighchiro.com. Please shoot us a direct message, send us an email. If you're watching this via email, that means you also received her newsletter with some more information. So please reach out. We are resources here to help you in any way we possibly can. So again, thank you, Ashley, and we'll talk soon. Bye-bye.